that. He has the sponsors up there with him. We're going to take this in its entirety today so you can hear about this event and how it will change this year. We know a lot of families rely on those school supplies, and then we'll get the COVID update that'll be following this part of the event. Let's take it down to City Hall now. Here is Mayor Sylvester Turner.
Okay, I think we're going to get started. Let me get started. I have with me a number of older people as I get ready to go back to school. So, good afternoon, and thank you for being here today. And I'm happy to announce one of my favorite events, if not the most favorite events for me, which is the 10th Annual Back to School Fest presented by Shell. And I'm joined today by Scott Ballard, Executive Vice President of Human Resources with Shell Oil Company, and Brian Green, President and CEO of the Houston Food Bank. Also Shannon Buggs, Director of Complete Communities, and Julius DePatch with my Office of Education. Both are also part of the Mayor's Health Equity Response, the HER Task Force. I also want to acknowledge members of City Council who have joined me, Councilmember Edward Pollard of District J, and Councilmember Carlos Cisneros of District H. Just last week, Harris County Judge Lena Hidalgo and I announced that all school districts must postpone in-person learning through at least Labor Day. That order was signed by the local health authorities for Harris County and Dr. Peirce, the City of Houston Local Health Authority. And it was done because we are in the midst of this pandemic. The order impacts thousands of students who are still adjusting to the challenges of the COVID-19 pandemic. And even though they will be connected virtually in the classroom, at least through September the 8th, and not in person, they still need the tools to be successful in their education. And just like the start of the school year, this year's Back to School Fest will be different than in previous years, but no less important. We have reimagined the event as a drive-through distribution in partnership with the Houston Food Bank, Shell, the HER Task Force. To accommodate the growing numbers of students who need assistance, the event will take place over a 2-day period on Friday and Saturday, August 7th and August the 8th, 2020. So instead of bringing 25,000 kids and their parents, family members to the George R. Brown, this time we're going to be bringing 25,000 kids and their family members to the NRG outside event over 2 days. And just like you saw those huge food distributions in the parking lot with all the volunteers and the State Guard with the Houston Food Bank, and this time we'll be back at NRG in the open big parking lots, meeting the needs of thousands of kids, but we're going to be adding a few other things. The event will be held at NRG Park in the Yellow Lot, not at the George R. Brown Convention Center. So it's NRG this year, not the George R. Brown. And I want to repeat, this year's Back to School Fest will be in the Yellow Lot there. And thank you to our friends at NRG for the space and for being so helpful. We also want to thank Jetco Delivery for providing the transportation of these backpacks. We appreciate Jetco's continued commitment to our students and community. I also want to thank Houston Special Events, Susan Christian and her team, for again putting on a stellar event. In addition to distributing 25,000 backpacks stuffed with school supplies to elementary school children, the Houston Food Bank will provide food, including produce, dry goods, and protein, to the families of these students. It is important that we wear our masks, not just because of the mandate, but because we need to slow the community spread of the virus. And that is why the Health Equity Response Task Force will distribute masks at the Back to School Fest. To participate, you only need to register at houstontx.gov/B as in boy TSF. That's houstontx.gov/B as in boy, T as in Tom, S as in Sam, and F as in Frank, for your children in grades K through 5. I am thankful to our partners for their commitment to Houston's youth and their families. For the 10th consecutive year, our generous presenting sponsor is Shell Oil Company. Cannot thank them enough. We cannot produce an event of this size or help the children that come through this program without their generous support. And to speak more on our partnership, let me welcome now Mr. Scott Ballard, the Executive Vice President of Human Resources with Shell Oil Company. Scott.
Thank you, Mayor Turner. Shell is honored to serve as the founding and presenting sponsor of the annual Mayor's Back to School Fest. Through our strong 10-year partnership, we have supported a variety of education programs that help prepare students for academic success. These continuing efforts are critical to support the talent pipeline, but also to sustain and grow the economic vitality of the community that so many of us call home. As the energy needs of the world change, so do the demands for more innovative solutions. It is our goal that with Shell's investment in this generation's academic achievement, students will be inspired and ready to tackle these challenges with the creative vigor necessary to meet the demands of supplying energy to more people while protecting our environment. This year has been an unprecedented year, so it is even more important for Shell to partner with the city and our community partners in responding to the needs of our families and by providing school supplies. Together, we are ensuring students are ready to start the school year. In closing, I really want to thank the mayor and his team at the City of Houston for dedicating so much time and effort to inspire the next generation of innovators and leaders for the City of Houston. Please join me in welcoming Brian Green, President and CEO of the Houston Food Bank.
Thank you, Scott. There's a lot of families really struggling out there. As I go to the distributions happening daily in our communities, it's so sad to see this many people who are really struggling to be able to put food on the table for their children. But Houston is really rallying to support our neighbors in need when they need it most. And Back to School Fest as a kickstart for so many children on having a good school year. It's going to be an even bigger challenge, and I'm just so proud of the way Houston is rallying to make this work too. It's going to be a spectacular event for these kids. They're going to appreciate it, and I'm so proud of Houston for doing this. Now please welcome Shannon Bucks.
Thank you, Brian. I just wanted to say that we are so proud from the Mayor's Health Equity Response Task Force to be able to be a sponsor of the Back to School Fest by providing masks for all of the young people that will be getting those 25,000 backpacks. We are giving an overabundance of masks in order for the families to have them for their kiddos as well as the adults. And we're doing this because we know that masking up is important. It is one of the most critical things you can do in order to protect the health of your young ones going back to school at home and when they eventually are back in the school classrooms. And it's also important for you to be continuing to do the social distancing within those homes as you are families trying to adjust to all of the changes that are happening right now with school. I'm a mom myself, and this is hard. And we know that it's going to take all of us collectively working together to make all of this work for our children, to continue to be educated. That's why the food bank coming forward, giving the food to help the kids get started in a healthy way, paired with Shell's contribution for making sure that these backpacks are filled with the supplies that our kids need, and a sense of normalcy to bring us back to the moment that is so important. We're getting ready to go back to school. We're going to make it work, Houston, by all working together. Thank you.
And now we'll bring up where's Juliet? Oh, there she is.
I just want to say thank you so much to Mayor Sylvester Turner, to City Council, and also to Shell. We are so deeply grateful. This is such a fantastic celebration. It's the 10th year of the Back to School Fest. And we know many different families from across this beautiful city come together on this very special day to volunteer, to make sure our children have the supplies that they need for another successful school year. And that's especially important now in light of the pandemic. And so we always know that we are going to invest in our most valuable and precious persons here in our city, and that's our children. They are our future, and you know that with this Back to School Fest, we've got them on the right foot forward, no matter the challenge. And so I want to say thank you so much, Mayor. I know you've got your backpack and you're ready to demonstrate and model, and we are just really, really grateful. Thank you so much.
Thank you, and we're joined now by Councilmember Carolyn Evans-Shabazz of District D. So look, we know that because of the community spread that exists, that schools within our city are not going to open at least until September the 8th. But the hope is between now and then that collectively as a community that we're going to do everything within our power to significantly reduce the community spread. And we're being futuristic, and that is at some point this fall, the hope is that our kids will be returning to school. And we want to make sure that they have what they need when they do return. But quite frankly, their return is in our hands. The parents, the adults, everyone. Their return is in our hands, which means is that it's so important if we want our kids to return to school this fall that we put on these masks and we keep them on when we're in the presence of other people, that we socially distance, and that we exercise the proper hygiene. And so I want to thank again Shell for being a generous underwriter of this program again. I want to thank the Food Bank, Houston Food Bank, the largest in the country, for what they continue to do. Her task force, because for this back to school event, the 2-day event, we're talking about the backpacks, the school supplies, the masks, and quite naturally the food, to address the food insecurities that exist in our city. So give them all a hand, and thank you all so very, very much. Thanks, Scott. Okay, we're going to transition.
Can we see the backpack, Mayor? Can we see the backpack?
Let me just say, you know, it's only a few years ago when I had these things on. Don't hate. Don't.
Thank you, Mayor.
Okay. And quite naturally, this part of the press conference, quite frankly, goes with the first part, because it's how we respond to this part that will determine at what point in time our kids return to school, hopefully this fall. The Houston Health Department today is reporting 325 new cases of COVID-19, bringing Houston total to 42,202. So that's 325. And even though the number is relatively low to the numbers that we have been reporting over the last couple of weeks, if not more, let me simply say you have to really look at that 7-day sort of total. And a lot depends on when we get the results back from the various labs. But today, 325 new cases. Sadly, however, we are adding 9 deaths, bringing the city's total to 400. Of the 400 total deaths, 89 are associated with nursing homes and 3 are associated with the Harris County jails. So 9 deaths are being reported. And again, this almost sounds somewhat sterile when you mention of it, but each one of these persons come from families with loved ones, friends, and so 9 families that will be permanently impacted. So that brings our total now to an even 400. Each death is listed on the monitors in front, on the side, but I want to highlight 3 deaths of Hispanic men in their 40s and 50s with no underlying health conditions. And again, in their 40s and 50s with no underlying health conditions. 6 of the 9 happen to be Hispanic. And the point is, the virus is still spreading in our community and is having a devastating impact on the Hispanic community and the city as a whole. To put this in perspective, let me also say that in the month of July, in this month alone, we have had approximately 22,000 people who have tested positive for COVID-19, 21,911 specifically, as you can see. And I want us to see the progression of this virus in our community. In March, we reported 377 cases, people who tested positive. In April, you can see that number is right at 3,226. In May, 3,793. In June, that number jumped up to 12,865. And today, in July, and this month is not yet over, 21,911. So you can see the progression of this community spread just in the month of July. Now take a look at the number of people who have died within our city. And on this particular chart, you can see in March a total of 4 people that died as a result of COVID-19. In April, the number was 52. In May, the number went up to 73. In June, it went up to 95. And as of today, again, with several days left in the month of July, that number now is 176. 176 out of 400, almost double, just in the month of July alone. It reflects that there is significant community spread, and it reflects the fact that more people are continuing to die as we proceed. What will be needed in order to slow that progression, to stop the number of people who are dying, is that we must collectively, not individually, put on our masks, social distance, practice proper hygiene, and take this virus very seriously. Now let me also say, if you are feeling ill and getting progressively worse, do not wait to go to the hospital or seek medical attention. Give yourself a chance. Give the doctors a chance, the hospitals a chance, in order to attend to your needs. So if you're feeling sick and you're getting progressively worse, don't wait until you just get so bad that it becomes very difficult to get the necessary care, medical treatment that you need. At the same time, let me speak to those younger individuals who are going out and about and returning home to your family members, to your parents, or to your grandparents, because there are multiple generations and families in our community, especially in communities of color. There are multiple generations. So to those, that younger population out there, please be mindful that you can bring this virus back to your family members, to your parents, or to your grandparents. So do not think that you're so strong that you cannot be a carrier, and even if you're feeling well. To the people who are at these events, these establishments, for example, of the weekend in large numbers, without your mask on and not engaged in social distancing, let me encourage you to take this virus very serious, okay? Because the reality is, in this city, more people each month are dying as a result of this virus, and more people are testing positive. The faster we get the virus under control, the faster we can get things back to normal in our city, state, and throughout the country. And I want to stress to people, if you are feeling sick, do not wait until it's too late to go to your doctor or the hospital. Also be mindful that we are seeing cases being spread amongst family, especially in households where children, parents, and grandparents are living together, and they do not have room for social distancing. And if that is the case, I want to encourage families to wear their masks inside the homes to protect your loved ones, especially if you've been to places where people were not engaged in social distancing and did not have on their masks. I want people to get complacent, because the number of positive cases today in many of our hospitals may appear to be going down. The reality is that the numbers, we may have plateaued in terms of the numbers that we're getting to the hospitals, or it may appear to be that the numbers are coming down, for example, in the hospitals. But the reality is that what my primary concern is what's taking place in our communities. And the numbers in our communities are continuing to be increasing, and the virus still is running rampant. So we all have a part to play. I'm going to continue to ask us to take this virus very seriously and to govern our behavior accordingly. It is about changing behavior. And I know this is the summertime, and I know people are antsy and they want to get out and about, but until we can get this virus in a manageable position, then we're going to continue to be saying the same thing over and over again until people simply get it, and then we can put all of ourselves in a much better position. Now let me yield and let me bring up Dr. Peirce.
Thank you, Mayor. We've got a couple of slides to show. We're talking about on Fridays, we calculate the positivity rate, and we announce those on Mondays. And so one of the things is this chart that's coming up here now, you can see is the number of cases of, that are tested positive and those that tested negative, and then we've calculated the positivity rate. And so you can see that as of last Friday, there's a chart there on the right-hand side that shows you going back several weeks, back to early May. You can see that the numbers were rising and peaked at about 25.9%. We have seen a slight decrease. It is down to, as of this past Friday, 23.3%. So that's a little bit less than a 3% drop, not a huge drop. Also recognize that when you look at the yellow and the red bars, that there's a little bit of a lag. So in 2 weeks' time, we look at those bars will be a little bit higher. And we will, of course, recalculate the positivity rates as we go on, as we get more data coming in, but there's a little bit of a lag effect. So those bars make it look better visually than it really is, so don't be misled by that. The positivity rate is the number that you need to focus on, which is still 23.3%, which is extremely high. So it goes to the mayor's point that the positivity rate in our communities remains very high. When we look at these, we locate the cases that are positive by zip code. We have our zip code map that shows, and again, if you look at the legend there, those zip codes that are in white, that does not mean that there's no virus there. That means it's less than 20%. And it's because there's so much viral spread. In order to make a differentiation, we start at 20 and we go up to the darkest blue means greater than 30%. And there are plenty of zip codes where the percentage is greater than 30%. So a couple of things. This shows where people reside. This is their homes. This does not necessarily reflect where they may have contracted the virus. Secondarily, I want to reinforce that those neighborhoods, those zip codes that have lighter colors or even are colored white, that does not mean that there's no virus there at all. It just means it's less than 20%. Even 20% is a very high value. So I just wanted to bring everybody up to speed on that. And again, if you look at these maps week over week, you will see that there is some change from zip codes a little bit. If we go back several weeks, it looks quite a bit different. And that's not a big surprise from an epidemiologic standpoint either. Let's talk a little bit about contact tracing. We've got some data on the contact tracing. We now have got the contact tracing. We're up to just about 300. I think we're just a few people short of 300 in our contact tracing. And this is a little confusing, so let me walk through this slowly. What this shows is that in the week of July 16th to July 22nd, there were 5,823 cases of coronavirus, new cases of coronavirus reported to the Houston Health Department. This comes from all of our reporting sources, not just our own testing sites, but all testing sites across the community within the city limits of Houston. So 5,823 new positive cases were reported in that week. We had complete contact information and reached out to 5,215. So our goal has been 85%. So from that standpoint, we did well. Remember, reaching out may be through a text message, it may be an email, or you may get a phone call, depending on what information we had. So we were able to, for everyone that we had the complete contact information for, we did reach out to them. Now, and the next meter shows that of all those positives that we got, unfortunately, only 4,042 of them were within a 10-day period where it was therefore actionable. It was beyond 10 days, it was really not actionable information. And we were able to reach out and establish a relationship with so that we can continue to follow 2,769, which is only about 68.5%. So that's frustrating to us. And some of this is because people don't want to engage with us. Some of it is because, well, that's basically what it mostly is, they didn't want to engage with us. We did reach out to them, either electronically or by phone call, and they either chose not to respond to us, or they did respond, but they didn't want to give us enough information. So that's both good news and mixed news, I would say, with that. And the other thing I just want to reinforce what the mayor said is that, and we've talked about this many times, is that when we can't, well, we as a community can get ahead of this virus by doing the things that the mayor has talked about and that we in public health have been talking about. But in order for us to get to we're in a mitigation phase now, in order for us to get to the point where contact tracing can really get a hold of this virus and stop it, we have to drive the numbers way down. So when we do reach out to you, and here's the information, when you get the caller ID, it'll be that number, 713-853-8700. That should come up on your phone now. We've got it so that should come up and say Houston Health. So if you get that call that says Houston Health, please answer the call. If you get an email from Houston Health Department at qualtrics-survey.com that says, please look at that email, answer the questions. Or if you get a text message from the numbers on there, 35134-73940 or 39242. Those are us sending text messages to you. Please respond to those, because that's how we're going to be able to find out who you, we're going to be reaching out to the cases. That's how we're going to find out who you may have inadvertently contaminated or infected, and that's how we're going to be able to stop this virus from a containment standpoint.
Thank you, Dr. Purse, and we'll take any questions or comments.
Good afternoon. I've got a question here from Channel 11 KHOU. What is Houston's, and I know Dr. Purse, you touched on this, but what is Houston's COVID-19 positivity rate, and what does that number tell us about the virus spread? And the second question there was, will federal support be extended beyond this Friday for COVID testing sites at Butler and Del Mar?
You want to take the positivity?
So the positivity rate is what I said is 23.6%, I think I said. And what that shows, that's a very high number. And so I'm glad you asked the question, because as the number is coming down a little bit, I really, really worry that people start thinking that, oh, it's all good now. It's not all good now. And I use the analogy that this school bus is no longer accelerating, but we're still going 100 miles an hour down the road, and there's a curve coming. So the fact that this is good news. This isn't great news. And what it says is that the things that we are doing as a community, wearing the mask, not having large gatherings, cleaning commonly touched surfaces, that they're working, but they have not worked. We're not done yet, but they can work if we continue to do it. That's what this says. 23.3%. Oh, yeah. So the federal support was a little bit confusing because there's both federal and state support that are going towards those. And actually, we just got word today from the state. So let me hold off on answering that question because that's a little bit in flux. We'll get back to you when that gets settled, okay?
Are we still on?
What I can tell you is that the Del Mar and Butler Stadium, the testing sites will continue, and I think we're trying to work out whether or not the partnership, the collaboration will continue. Okay, but either way, it will continue. But we are trying to work through some things, even as of today.
We're going to let the poll exhaust your questions first.
All right, this one is KPRC, but it is not COVID related.
We'd like to keep it to COVID, and then if anybody's around, we'll do them afterwards. Thank you.
Well, I just wanted to know, Mayor and Dr. First, number one thing was, are we still at like 7-10 days for returning for those public sites? Are we better at getting testing results back? I think that's consistently an issue with.
And that's what we are in the process of working through. We're working through discussing an arrangement where the test results can come back within 2 to 3 days. And so I think we'll be able to have an announcement probably on that probably tomorrow.
And have you had issues with folks complaining about private testing and perhaps being surprised by a bill or two later on? Did those complaints ever make it to you guys? And is there anything the city can do to try to rein some of that in?
We've heard about that. Of course, we encourage people where possible to do the public testing because all the public testing sites are free at all of those sites. On the private testing, it's certainly very important for people to get a good understanding before they go. But Dr. Purse, maybe you can address that.
Yeah, the mayor's right. So the public sites, we're trying to do that at no cost. But some of the private sites, we have got complaints where they feel that they were told there would be no cost, and then sometimes they found out that their insurance company was billed, and they still didn't have to pay a copay, but they were upset that their insurance company. In other places, their insurance companies then turned around and hit them with a copay, and they were not expecting that at all. Now, unfortunately, we don't have any control over that, but I do think that for those testing sites that are working with that are not our testing sites, I think transparency is important, and they need to make sure that the people are informed properly as to what if there's going to be a bill that they may wind up getting a bill. But we have heard those complaints. Yes.
And I just wanted one or both of you to perhaps talk about this issue, especially in the Hispanic community. I was talking to a man today who lost a loved one, and they were saying, there's families want to get together. They want to be with each other. This is how they show love. And the challenge is when they do that, sometimes within their own family, they get COVID, and then their loved one dies. So it's trying to figure out how do you show love with one another in your own family and try to protect the people you love.
Well, I would tell you that one of the ways you can show love with your family members is by social separation. Separation in this day and time does reflect showing love. Even in my own family members, for example, I haven't seen my daughter even in my house for more than 2 weeks. Okay, we do a lot of talking on the phone and things of that nature. Even with respect to my own siblings, and even when, just like on yesterday, when I went by to check on my brother with his and my sister, and there was a provider. I was only there for a short period of time, and while I was there, my mask was on and their mask was on. So these are challenging times. But if we want our loved ones to be around, for example, I think we have to be mindful of what we are doing ourselves. You can't, you're not showing very much love, for example, if people are out and about and engaging in activities or gatherings with large groups of people, and then you're returning home and possibly bringing what you got away, bringing it to the home. And oftentimes, and we're hearing stories where loved ones, children, young adults, and others have returned who are staying at home with their parents or grandparents, are coming home, and in some cases they're testing positive, and now they're at home with their loved ones. And this is especially true in multi-generational families at homes where you can't really social distance and you go to one room and you stay there. That makes it very, very difficult. So this is just one of those times that if you love your parents, your siblings, other relatives, you have to really somewhat deny yourself, sacrifice, okay, and not go to places where there are large gatherings and people don't have on their masks and they're talking and laughing and drinking, and then you return home just because you feel well for the moment and you're affecting loved ones. It's a tough time, but we're all being asked to make the sacrifice such that we can be with our loved ones over the long run. You don't want to do the short term, and then you end up seeing them in the hospital or having to bury them. And quite frankly, even funerals are different than the way they have been. Okay? And I will tell you, just over the weekend, I got a call after 11 o'clock. A close friend, a friend of mine, who was in the hospital. Both lungs were not operable. Family members made the decision that they didn't want him to suffer anymore, and he passed. So these are challenging, difficult times. And today, we are announcing 400 people who have died inside the city of Houston. 400. And 176 of them are in the month of July alone. So we're going to have to assume some personal responsibility. And just because we are tired and bored and we want to get out, well, this virus wants to get out as well. And when you get out, you let the virus out too. The problem is when you go home, you have served as a station wagon for this virus, and you have driven this virus right into that home.
This is a different topic, if that's okay.
Sure. It's about that time.
Okay. From KPRC. Since Harvey, the county has been able to work without issues with the GLO. Obviously, there are issues between your administration.
Say it again?
Since Harvey, the county has been able to work out issues with the GLO, General Land Office. Obviously, there are issues between your administration and the GLO. What would you have done differently to get homes repaired and rebuilt after Harvey?
Number one, the premise of the question is wrong. The county gave up their GLO program.
Okay.
City didn't. We were much further along, and all we have sought is a partnership. And quite frankly, the judge in Travis County heard both arguments from the city and the state GLO, and the state district judge ruled in the city's favor.
You might be able to clear this up then.
Sure.
The federal government sent Houston millions to repair homes. Houston, did y'all do one, maybe two in the years? And
the total premise of the question is wrong. HUD didn't send one dime to the city.
Okay.
They sent $1.1 billion, but they sent it to the state. We have a reimbursable program. We only get reimbursed for the work that's been done. And so the city never received one dime in the city's account. They sent $1.1 billion to the state of Texas. So the premise of the question is not true.
Thanks for clearing that up. Thank you,
Okay,
Mayor.
sure. Anything else? Let me just say in closing. Last week we announced the death of one of our city employees, Edward Zilton, who works in solid waste, the solid waste department. He was the deputy assistant director in solid waste. Edward Zilton died as a result of COVID-19, and we want to extend our prayers and condolences to his family. He was a faithful employee, and so Edward Zilton. I also want to make note that the funeral services for Captain Lucio, captain in the Houston Fire Department, those funeral services will be tomorrow. He resided in San Antonio, and so those funeral services will take place in San Antonio. Captain Lucio with the Houston Fire Department and Chief Pena and others will be attending his funeral in San Antonio. And we want to lift up his family and extend our condolences to his family as well. So let me thank you all and appreciate it. Okay?
All right, Mayor Turner there wrapping up his press conference today talking about what it'll take to stop this virus from spreading. He started off today talking about his Back to School Fest. It's been going on now. This will be the 10th year. It's going to change this year because of COVID. We'll just give you the quick details there. It's a drive-through event now. It's going to be at NRG outside in the yellow parking lot, not at the GRB at the convention center as it normally is. We're talking about 25,000 backpacks with supplies for kids through the 5th grade. Food and masks will also be provided, and you see the website there to register. I just tried that website when he mentioned it. It did not come up yet for me. It may not be live at this point, but again, you have some time here. The event, 2 days now, August 7th and 8th this year. HoustonTX.gov/BTSF, Back to School Fest. Let's look at the latest numbers here. The mayor revealed those 325 new cases. Mondays are usually a lower number because of the weekend. Keep that in mind. 9 new deaths now, and even 400 people in the city of Houston have died from COVID-19 related causes. And you see the other numbers there. Dr. Pers and the mayor both saying we need to take this virus seriously. We still, are a runaway bus basically at this point, as Dr. Pers put it, 100 miles an hour, and we're headed for a curve. So the speed may not be going up, but it's not coming down either. And that was the message today from the mayor and his team. We're going to let you go here, get back to regular programming. Keep this in mind. You can get the latest anytime on our website, of course, khou.com, or by downloading the free KHOU mobile app. Another 15 minutes or so of The Ellen Show, and then we'll see you back here for the 411 at 4 o'clock.
Better results. Hey, can you